It is the #1 opportunity within United Physicians to improve in terms of our EBC scores. 1 in 20 people are going to be diagnosed with colorectal cancer, and of those, 1 in 3 will die from it. This is a totally preventable number. 30,000 people will die per year from colorectal cancer. Colorectal cancer is the #2 killer out of cancers of men and women. So we really need to be more engaged in getting our patients aware of the risks of colorectal cancer and making them aware of the numbers, dispelling the fears that they have about colorectal cancer screening, and also getting practices involved in terms of identifying patients that are in need of screening. The HEDIS measure for colorectal cancer screening is that all people between the ages of 50 and 75 should be screened for colorectal cancer. There are a lot of concerns with patients for not screening. The primary one is fear and anxiety. Patients are afraid of having the test done for various reasons. They fear the prep, they fear the procedure itself, they fear that there's going to be a large cost expenditure on their part. They're afraid that they're going to be embarrassed by the procedure in and of itself. And so the goal is really to try and dispel the myths for these patients, because the Affordable Care Act does provide for coverage for colonoscopy, colorectal cancer screening. The procedure in and of itself is really not painful. You'll be sedated. You're not even going to know that it happened. You're going to wake up and it's going to be over. The prep is much more refined, and it's not as awful as it used to be considered in the past. And doctors that do colorectal cancer screening and colonoscopies are experts in their field that are used to doing this. They're very professional about it. They treat you with the utmost of dignity. The goal of colorectal cancer screening is a little bit different than the goal of maybe some other cancer screening, because the goal is to detect a polyp in the colon before it even becomes cancerous. And so by doing early testing, such as a fecal occult blood test, a FIT test, or a colonoscopy, you can detect these polyps in the early stages and remove them before they even become cancerous.